Benign paroxysmal positional vertigo, BPPV, is the most common vestibular disorder and occurs when loose calcium carbonate debris has broken off of the ectoconial membrane and enters a semicircular canal, thereby creating the sensation of motion. Patients with BPPV may experience brief periods of vertigo, usually under a minute, 9, which occur with change in position. This is the most common cause of vertigo. It occurs in 0.6% of the population yearly, with 10% having an attack during their lifetime. 10. It is believed to be due to a mechanical malfunction of the inner ear. 10. BPPV may be diagnosed with the Dix-Hallpike test and can be effectively treated with repositioning movements such as the Epley maneuver. Symptoms. Vomiting is common, depending on the strength of the vertigo itself and the causes for this illness. Nausea is often associated. Paroxysmal, sudden onset of episodes with a short duration, lasts only seconds to minutes. Positional in onset, can only be induced by a change in position. Pre-syncope, feeling faint, or syncope, fainting, is unusual but possible. Rotatory, torsional, nystagmus, where the top of the eye rotates towards the affected ear in a beating or twitching fashion, which has a latency and can be fatigued. The vertigo should lessen with deliberate repetition of the provoking maneuver. Nystagmus should only last for 30 seconds to 1 minute. Visual disturbance, it may be difficult to read or see during an attack due to associated nystagmus. Vertigo, spinning dizziness, which must have a rotational component. Many patients will report a history of vertigo as a result of fast head movements. Many patients are also capable of describing the exact head movements that provoke their vertigo. Purely horizontal nystagmus and symptoms of vertigo lasting more than 1 minute can also indicate BPPV occurring in the horizontal semicircular canal. Patients do not experience other neurological deficits such as numbness or weakness, and if these symptoms are present, a more serious etiology, such as posterior circulation stroke or ischemia, must be considered. The spinning sensation experienced from BPPV is usually triggered by movement of the head, will have a sudden onset, and can last anywhere from a few seconds to several minutes. The most common movements patients report triggering a spinning sensation are tilting their heads upwards in order to look at something, and rolling over in bed. Causes. Within the labyrinth of the inner ear lie collections of calcium crystals known as ectoconia or otoliths. In patients with BPPV, the ectoconia are dislodged from their usual position within the utricle, and migrate over time into one of the semicircular canals. The posterior canal is most commonly affected due to its anatomical position. When the head is reoriented relative to gravity, the gravity-dependent movement of the heavier ectoconial debris, colloquially ear rocks, within the affected semicircular canal causes abnormal, pathological, endolymph fluid displacement and a resultant sensation of vertigo. This more common condition is known as canalolithiasis. In rare cases, the crystals themselves can adhere to a semicircular canal cupula, rendering it heavier than the surrounding endolymph. Upon reorientation of the head relative to gravity, the cupula is weighted down by the dense particles, thereby inducing an immediate and sustained excitation of semicircular canal afferent nerves. This condition is termed cupulolithiasis. There is evidence in the dental literature that malating of an osteotome during closed sinus floor elevation, otherwise known as osteotome sinus elevation or lift, transmits percussive and vibratory forces capable of detaching otoliths from their normal location and thereby leading to the symptoms of BPPV. It can be triggered by any action which stimulates the posterior semicircular canal, including looking up or down, preceding head injury, sudden head movement, rolling over in bed, tilting the head. BPPV may be made worse by any number of modifiers which may vary between individuals. Changes in barometric pressure, patients may feel increased symptoms up to 2 days before rain or snow. Lack of sleep, required amounts of sleep may vary widely. Stress. An episode of BPPV may be triggered by dehydration, such as that caused by diarrhea. For this reason, it commonly occurs in postoperative patients who have diarrhea induced by postoperative antibiotics. BPPV is one of the most common vestibular disorders in patients presenting with dizziness. Migraine is implicated in idiopathic cases. Proposed mechanisms linking the two are genetic factors and vascular damage to the labyrinth. Although BPPV can occur at any age, it is most often seen in people over the age of 60. Besides aging, there are no major risk factors known for developing BPPV, although previous episodes of trauma to the head, or inner ear infections known as labyrinthitis, may predispose individuals to future development of BPPV. Medicine by Alexandros G. Sfakianakis, Anapaphysios 5 Agios Nikolaos 72100 Crete Greece, 00306932607174030302841026182, alsfakia@gmail.com.